right, we'll see. It says preparing to live stream, and now I'll see whether it is a Facebook thing or whether it is a streaming thing. So it says it's setting up my
I don't
webinar.
see you, though.
No, you will in a second.
Okay.
It's just now. Okay, we're on. I think we are on.
Okay, I don't see you still.
Do you see me?
I don't.
Oh, do you see me now? There's a delay.
Oh, there you are. Oh, yeah, no, sorry, we had the wrong thing. Yep. Hi.
All right.
Can you hear me?
You don't see me?
I can see you.
Hey, Leah. Hi, how are you?
I'm good. How are you?
All right. Okay, we're on. Great. All right, Leah. Hello, everybody. Sorry about that really weird beginning. There's a slight delay on this. I can hear you.
Can you hear me?
Yes, I can.
Great.
Yeah. So I'm here tonight with Dr. Monica Agarwal.
Hello?
And so Monica, because there's some weird delay on this. I'm so sorry, everybody. It's a little bit strange. Monica, tell us about your story. Let's just get straight into that. Let's let you speak.
Sure. So first of all, can you hear me okay?
Yes.
Okay,
can everybody hear?
I don't hear anybody else, so I don't know if the only person I hear is you. So I just want to make sure if somebody else is talking that you can.
Yeah.
We're good? We're good. Just give me 2 thumbs up if we're good again. Awesome. Okay. Woohoo! Just takes a few minutes sometimes, technical glitches. So I'm a cardiologist, and I have been in practice in cardiology for about 10 years. And so I developed, so I have about 7 years ago, so my daughter is 7.5. So about 7.5 years ago or 7 years ago, I started developing chest pain. I'm sorry, I'm distracted here. I've got all these different sounds around me here. Okay. So I started developing pain. So it started out, I was an active runner, and I was active full-time cardiologist. I already had 2 children under 4. So I had a 4-year-old, I had a 2-year-old, and I was pregnant with my 3rd child. This is about 7.5 years ago. I did fine through the pregnancy, and then after I delivered my 3rd child, I was doing great for the first 4 months, but I was running ragged. I was sleeping 4 hours. I was nursing and pumping. I was working full time. And you can imagine my life where I walk in the door and I had to nurse the baby because I was massively engorged. I have 1 2-year-old who wanted all my attention and a 4-year-old who's trying to reach for me all the time. But that was the life I felt like I'd chosen. And so I ran around a lot and felt like, this is what was needed in order to have it all. But about 4 months after I had my 3rd child, I started developing pain in my joints. And it started out with a finger. And I remember when it hurt my finger, I thought, gosh, I'm an active person. I'm always running and doing crazy things. I must have just injured my finger. So I ignored it. And it was red and inflamed. And a few days later, it went away. And then it was another finger on the other side. And I remember thinking, gosh, that's strange, 2 different sides. Oh, well, just didn't think too much about it. It started migrating all over my body. It went to my knees. I started getting a red hot knee. And I remember it was my shoulder. And I started getting just pain all over. I remember it was so bad that I remember thinking that I was going to write a letter to baby clothes companies because they were making, all the clothes had snaps on them. And I couldn't do this fine manipulation to snap the clothes. And I thought it was the clothes' fault and not mine, of course. And I remember my feet. Anyone who ever was diagnosed with an autoimmune disease would know the feet are like the worst thing. I remember feeling like there was ice or glass cutting my feet all the time. And so I changed my shoes 3 times. And I said, I must have the wrong shoes because my feet hurt all of the time. And it felt like just glass cutting them all day, but worst in the morning. But I still ignored it. I remember I ignored it and felt that these pains were going to go away. Decided I was going to write letters to clothes companies. I was going to write letters to change shoes. I had all these plans. And I remember everything came to a head one day when it was like 4 o'clock or 5 o'clock in the morning, and I was hobbling down the stairs. My alarm went off. I was hobbling down the stairs to walk, let the dogs out. I have 2 dogs, and I wanted to start getting the food ready for the kids because I had to get my 2 and 4-year-old ready for preschool. And 5 o'clock in the morning, and I was hobbling down the stairs. My alarm went off. I was hobbling down the stairs. Weird. There's like a delay. I can hear it now. I have 2 dogs, and I wanted to start getting the food ready for the kids because I had to get my 2 and 4-year-old ready for preschool. And 5 o'clock in the morning, and I was hobbling down the stairs. My alarm went off. I was hobbling down the stairs. There's like a delay. I can hear it now. I have 2 dogs, and I wanted to start getting the food ready for the kids. I had to get my 2 and 4-year-old ready for preschool. Is this working?
I know. On the sound, and I'm not quite sure why.
What should I do? Should I keep going? Should I keep going?
Sorry, everybody. We're having a slight problem with streaming. I think it's the sound that's just a little bit weird. You're probably hearing it okay, but Dr. Agarwal and I are really having a problem because there's this incredible delay that we can hear each other. So it's a little bit weird. Let us know what you're hearing, by the way. You're good now. Keep going.
Okay. So this is one of those movements I want to say Bueller. Okay, so I remember that day well because I went down the stairs and trying to make the...
Okay, so Dr. Agarwal, they are all saying that they can hear us okay. So why don't you just continue on? I know it's really distracting with the delay, but please just continue on.
Okay. So if I sound kind of weird, bear with me, guys, because it definitely is a weird sound here on my end. Okay. So what was happening was, so I was trying to make the food for the kids, I was starting lunches because I had the 2-year-old and the 4-year-old who needed to go to daycare. And the baby started crying. And so I didn't want her to wake up the 2 and the 4-year-old. And so anyone who's ever been a mother before knows that you have to get up like 2 hours early in order to get everything done in the morning, the nursing, making the lunches, getting the dogs ready, then getting yourself ready. And so I didn't want the baby to wake up the other 2 kids. So I tried to run up the stairs and pick her up. But I remember that day so well because I couldn't get up the stairs that day. And I had to crawl up the stairs because my knees and my legs were so in pain that I couldn't get up. My husband found me at the bottom of the crib crying because I couldn't get the baby out of the crib. So I remember that he then went and picked up the baby and brought her to me so I could nurse the baby. And I remember that day so well because it was the day I realized I really had a problem. So I did what every good doctor does, which is I treated myself without still seeing a doctor. I decided I had Lyme disease. So migratory joint pain, I'm an active person, I'm always outdoors, I lived in a wooded area, it made sense. I must have Lyme disease. And so I started treating myself, but I didn't get better. I got worse and worse. I started sneaking around the hospital because I'm the person who runs up the stairs, but I couldn't get up the stairs, so I would take the elevator. And so I finally went to the best rheumatologist in town, and because I knew I wouldn't hear it well from anyone else if I hadn't gone sort of the top center, whatever that means. And so I went there and I saw the chief of rheumatology, and he told me, oh, I forgot to tell you, I got some blood work done first. I guess that's important. because in between my treating myself for Lyme disease and not getting better, I still didn't go see a doctor and first asked an internist friend of mine to order some blood work for me. And she ordered the blood work for me, all these inflammatory markers. And she's the one who first said, you got a problem. You need to see a rheumatologist. Because my autoimmune markers, my rheumatoid factor and my anti-CCP antibody, which anyone who has rheumatoid on this casting would know, were through the roof. So that's when I went to that rheumatologist, and he told me I had advanced rheumatoid arthritis. He told me overall that my prognosis was fairly poor, that I would need to get on advanced therapies within a week. He wasn't sure about my manipulation. He said that my numbers were so high that he thought that I would be on medications for the rest of my life. He said, there is no cure for this illness. So the thing you have to understand and prepare yourself for is not that you won't feel better. We will get you feeling better, but that you will never come off medications again. He also told me that I needed to stop nursing my baby, and I needed to do it within a week because I had such advanced inflammation that if I didn't start the medicines, that I would start seeing destruction pretty quickly. And
wow, that's just incredible.
So I started taking medications in a week, and I got better. I just had to stop nursing the baby. It was the hardest week of my life, where I had to walk away from my crying kid because I couldn't feed her. And I remember that feeling of engorgement and just crying every day, but I did it. I did what I had to do. And a week after I was diagnosed, I started taking medications, and I got better. But I got worse. I had loads of side effects. My hair started falling out. I had a metallic taste in my mouth all the time. I didn't want to eat. I was always nauseated. I lost weight. So I was better, but as anyone who's ever taken medications, and certainly I had given out my share of medicines, side effects are things you learn to live with.
That's terrible.
So anyway, I got better, and I continued to be my active self. I went back to running and doing all of the things I normally do, and I just became a patient who takes medications. So that is how it started for me. Should I go on, or is there a delay for you still?
Yeah, absolutely. Yeah, okay. Go on, because we want to hear your journey, Dr.
Okay.
of how you healed yourself through this.
Yeah, so what happened was, so I think I was on medicine for maybe 6 to 9 months, maybe longer. And I met a woman who, I used to run these community fairs quite regularly. Sorry, that's my baby girl. And she, I used to run these community fairs, and this nutritionist came to meet me, and she said, look, I want you to, I want to be part of your fair. I want to be part of it. I want to teach people about nutrition. I said, I really don't have any space for a nutrition person. I already have a few people, and I don't have enough room for another person. So she said, well, look, let me just do your profile. Let me just teach you about your nutrition. And I was kind of cocky. I was obnoxious. I said, what do you mean? I'm vegetarian. I'm an active runner. I got this. And how ironic, because of course I hardly didn't have it at all. I was sick. I was taking medications. And so some part of me humored her, or felt that the laugh was on me, that I thought I was humoring her. And I did a profile for her. And she was the first person to ask me and start making me think about the way food triggers inflammation in your body. And she was the first person to make me think that food could affect people differently. And so it started me on a journey that went on to learning a lot of self-education and learning about the gut biome, and learning about inflammation, about autoimmune disease, immune markers. And over a couple-year period, I just completely immersed myself in nutrition. I went to Harvard. I spent some time with some of the microbiome people there, and I learned a load. And about 4 years ago now, now 5 years almost, I came off all of my medications. I remember it because I did my first triathlon, and I remember my first triathlon was done on the day I had been off of medications I had just come off my medications. I did my first triathlon as sort of as a congratulations to myself. And I did complete it. And I haven't looked back since, and I will never look back. I haven't been on medications for almost 5 years, and I continue to be extremely active, and I'm not looking back.
That's just absolutely amazing. That's why I wanted to have you on to speak to everybody, because, you know, to have somebody who has the credentials that you have. And for those of you who, you know, are watching, you know, Dr. Monica Agarwal is the director of cardiology at the University of Florida and prevention. And so she really, you know, has an incredibly high powered job. You have 3 children, correct?
I do.
3 young children.
3 little widgets. Yep.
Yeah. And so, you know, for her to go through this journey, to be a very busy working woman with these credentials and everything else, you know, we talk so much in my community about inflammation, that it was, and also interesting to me how inflammation is connected to heart health as well. And so to me, it's just so interesting. Can you tell us a little bit more about nutritionally the changes that you made once you started doing all this research?
So I think the fundamental concept that people have to understand, including myself when I went through this, is that you have to imagine that what you eat and what you do affects everything. Well, that seems obvious, but imagine it like this. I always think of it in terms of supply and demand. And if you have certain things in your body, if you have an imbalance between supply and demand, you trigger inflammation. So the supply are things like, well, let's do demand first. So what are the demands? Because everybody can think of the demands on themselves. Well, the big demands that most of us have are like high-level stress jobs, lack of sleep, sedentary lifestyle, poor nutrition, the poor environmental exposures like too much sun or noise pollution. These are all demands on our body. And similarly, we have loads of supply, loads of things we can do. We can sleep better, we can drink clean water, we can eat clean foods, we can meditate, we can do yoga, and all of those things are the supply that we have. But when there's an imbalance, which most of us have between supply and demand, that's a trigger for inflammation. So if you imagine that food is one of those triggers, then you can say, well, what exactly happens that triggers that inflammation? So it's when you put food into your body, it goes into your gut biome, it goes into your gut, and you involve these little bugs in your gut, and their job is to prevent all of those toxins from the food you're eating getting into your bloodstream. But there's certain foods that become a trigger for people and can actually cause what we call a leaky gut, where actually the junctions between the little colon cells actually pull apart. So then what can happen is that the blood, then the toxins can enter the bloodstream, and then that triggers inflammation. Well, inflammation in a small degree is a good thing. It allows us to respond to illnesses, but in a chronic state, then it triggers long-standing inflammation. For certain people, that inflammation, based on your genetic predisposition, will go and become diabetes, and you'll become type 1 diabetic. Some people, it'll be autoimmune disease and lupus and rheumatoid, and other people, it'll be inflammatory heart disease, which most heart disease is caused and triggered by inflammation. Some people, it'll be strokes, and some people, it'll be cancer. And so there's one part of it is that you have genetic predisposition, and one part is the dietary influence or just influences from your lifestyle in general, which then trigger inflammation. If you can then imagine that you have all these lifestyle tools to then, so it's not that I can't change your genetic predispositions. Similarly, I can't change my own. So, but I do believe that there's a way that if there's a trigger that turns on that genetic predisposition or turns on that gene and it causes that gene to express itself, then there must be a way to suppress it as well. And so, because activation and suppression, if we activate it, then why can't we suppress it? So I think that a lot of things that we do in our lifestyle in that supply section allow us to suppress that gene expression. So a case in point of this is celiac disease. The celiac disease is the allergy to gluten. Now that's different than gluten sensitivity, which a lot of people feel they have, but only about 2 to 3% of the population have gluten allergy. Well, an important thing to think about is they have an allergy to wheat. So when people who have celiac disease, they eat wheat and it goes into their gut, and they actually have those breaks of those cells, that leaky gut, blood, the toxins get into the bloodstream, and you have this chronic state of inflammation. Well, celiac patients don't just get problems with diarrhea. They have problems with their skin, and they get problems with skin rashes. They get neurologic symptoms of headaches. They can even get as bad as seizures. You get joint pain. So it's a case in point of how a food you eat can then trigger inflammation through your gut and then can cause a systemic illness. So why can't there be other triggers? Why can't there be other foods that are triggers for other people? That's the fundamental thing that we have to consider, that there are certain things that are triggering inflammation in our bodies, and our job then is to find out what those things are that are triggering inflammation in us.
So basically, what I'm hearing you saying is that it's not a one size fits all. So what part of our first job, if you like, is to do a bit of detective work, maybe do an elimination diet, maybe keep a food diary, maybe do both of those to start understanding what your triggers are. Would you say that would be the first thing to think?
I do, yeah. So in my prevention clinic, I have hour-long visits, and what patients do as part of their first job is to make a food diary. And so I make them do a week-long list of what they're eating. But for most people, the inflammatory triggers are similar. You know, they're usually things like dairy, refined foods, processed foods, meat, for different people. But different people have different levels of triggers for different things. And so I think that it's certainly not a one size fits all. For instance, I can put people on a 100% plant-based diet, but if I haven't fixed other things like their sleep, their activity level, I also don't heal them completely. And so I think it's important to understand, for all of us who believe in the plant-based mission, which I certainly do, is that it isn't a one size fits all. I have different treatment plans for every patient based on who they are. Some people, their stress levels are so high, all we do in the clinic is meditate. And so I guess I want people to understand is that I believe in a plant-based mission. I'm 100% on board, but I also want people to realize that it's not just one part, it's just one part of a bigger picture. And
oh my gosh. I have to say that you and I are the same person. We are singing the same tune, and I love you so much. It's so great to hear, you know, a cardiologist speak like this, because I feel exactly the same way. I've always said that, you know, if you could be eating a whole food plant-based diet, but if you've got toxic relationships all the way around you, and you're, you know, more stressed than you know what to do with, and you never exercise, then you're just not going to be well. So I love that. Obviously, I mean, what you do is called in many ways, it's functional medicine or lifestyle medicine, correct, Dr. Agarwal?
Yeah, I mean, I guess so. People have often tried to term something about what it is that I do, but you know, I tell people that I don't believe, and I look forward to a day when we don't have to call it functional or lifestyle or alternative or complementary medicine. This is just medicine. It's just good medicine, you know, and that's what I do. And I just try to practice good medicine. You know, it's interesting. People come to my clinic every day. They're not all, people are coming from all over, and it's interesting to hear their stories about what they're frustrated by and what they would like. And I think some people think that they're going to get very clear direction about one specific thing, but I don't actually know what they're going to get when they leave until I see them in clinic, because so many people need very different things. And sometimes it's a lot of talk. We talk about negativity and positivity, and sometimes we talk about joy and laughter and loving self. And so these are all things that I think are important and things I advocate, recommend, and strongly believe in.
I love it. Love it.
Yeah. It's true. I mean, you should see my patients. They're doing amazingly. And I work with doctors a lot because ironically, doctors and CEOs and people that are execs, they're often the people who are the most resistant to taking medication. And so I find it so ironic because we as physicians give out so many medicines, yet we are so resistant to taking any at all. And so I see a load of physicians, and they often come in, and sometimes what we focus on is just learning to love the self. And people are kind of blown away by simple changes I have them do and how much change it makes for them. And so I don't want to undermine any one part because there are so many different parts, but to focus on nutrition, and personally for myself, I didn't just change my diet. I started sleeping. I started nourishing other parts of my soul. I meditated, I did a load of yoga, and I did all of these things to sort of strengthen my body. Can you tell us?
Oh, that is a beautiful, beautiful thing. You know, it's funny, Dr. Agarwal, because I run wellness retreats. And,
Yeah.
you know, I think people sometimes come along to the wellness retreats and think I'm going to, you know, learn how to eat really healthy and do a bit of yoga. And it always turns into something that's so much deeper than that. It turns into something that's so deeply transformative because as women, anyway, they're women's retreats. We come together and we bond and we laugh and we cry, and somehow we get to that place where we can just love ourselves again, which is so hard but so necessary, and it's so deeply healing. And people at the end of it, we're like, everyone's like, oh, I thought we were going to learn how to, you know, to have what to put in a green smoothie. And I'm like, no, because that's not transformation. So I love what you're saying, and it's so unusual to hear that from, you know, a doctor, from a cardiologist. So this is
I always tell
wonderful.
people, one of the things I have that I keep the most in my office clinic is tissue boxes, because there's so much weight that we're all carrying, and there's so much that needs to be discussed, and so much of the time that's what we do. And so it's a little bit off topic if we're talking about plant-based nutrition, and I don't mean to take away from that, because I truly believe in it and spend a lot of time on that as well. But I just wanted to make sure that you understood that I believe that there's so much more to it, and I do put so much emphasis on those other things. So in terms of my own sort of nutritional lifestyle change, I would say that I found that my trigger for inflammation in terms of food, I thought, was dairy. And I think dairy is a trigger for inflammation for a lot of people. And so I found that when I eliminated dairy, I was incredibly better. I got better within weeks. I knew I was better. I mean, you know, when I counsel people on lifestyle nutrition now, I sort of give them this, well, there's a honeymoon period for about 2 to 3 weeks where you're going to hate me. And then about after that 2 to 3 weeks, because you're making all these changes and your gut's changing and you're going to start feeling like I'm taking things away, it's going to be this weird feeling. But then after 2 or 3 weeks, you're going to start learning to love not only yourself, but you're going to start loving me too.
Oh my God, that's so beautiful. And it's so beautifully said. I just want to I want to just sort of just have bottle everything you said, because I think it's so true that it does take 2 or 3 weeks to sort of, you know, when first I'm working with anybody, they're like, oh, the sugar and the cheese is a big one. But I go, just stay with it, because it is difficult, but your taste buds change. And that's what happened for me. My taste buds, they absolutely changed when I stuck with it. So much so that after a period of time, suddenly, you know, vegan cheese or a piece of fruit or something, suddenly those tastes really sort of came out. So it's sort of breaking that cycle. And I love what you say, that, you know, you'll end up hating the person who advocates those changes, like my husband with me. But then 2 years down the line, he's like, thank you, because he gets to kind of love his body. By the way, will you pick up your book to show everybody?
Oh, sure.
Because Dr. Agarwal has a book, which I am certainly going to get. Oh, no. Yes. Yeah.
So, I'm just messing. Yeah, there it is. Finding Balance.
So Finding Balance, Prescriptions for a Better, More Vital You. And it's available on Amazon, correct?
It is, yeah. So, you know, I wrote that book as to honor my daughter, because there were so much time that I felt so much anger and frustration about sort of having a third child, and how I had gotten sick because of her. But it took, you know, and I talk about that in the book, is that I learned that it wasn't that my daughter because I had my daughter that I got sick, but it was because of her that I learned to heal. She's the one who actually saved me. So that book is written to honor her, and it's dedicated to her, because she is the reason that I started down this journey and made me into where I am today. Now, one of the things I always tell people, and I just want to say one thing, is that I have a lot of patients, and there are people like on your stream that I'm sure that are total believers in what you're thinking, and some people are half believers, and some people are casual listeners. And so I would say what I say in my clinic to a lot of people, which is, you know, some people come in and say, I hear what you're saying, but here's the thing, I just can't give up my ex, whatever that is for you, you know. And I say, okay, you know, I understand that, makes sense. So I'm going to offer you a future that I want you to think about. So future that you're on as a diabetic, high blood pressure patient with high cholesterol tells me by data that you have a 10% risk of having a heart event within 10 years or 20%, or depending what their risk is. Or I can offer you a change where you can change your nutrition, you can change your lifestyle, and you can change that number so significantly that I can offer you a future not only that is bright and longer, but that it's going to feel healthier and stronger. And so I often tell people, I say, well, what is it worth to you to eat that little bit of cheese, or to eat that one thing that they can't give up? What's it worth to you? Is it worth your whole future? Because to me, it's not. Like, I will never go back to eating dairy. I will never go back, because to me, getting sick, I was so sick and I was so down. And when you're that small and that hopeless and lacking in control, it's what you'll never go back to that. You never will want to go back. And I think the thing about being sick, the thing that people don't realize is that sickness, people hate being sick, not because of the sickness itself, which is the worst, but it's the lack of control. You lose so much. You lose your ability to make your own decisions. You're at the whim of a medicine, of a doctor, and of your body. You lose that control. And that's something I will never give up, is the control of if I have choices I can make that can make me better, why would I ever choose an alternative?
Amen to that. I mean, seriously. So look, everybody, first off, I want to say, I am sorry we've had so many technical difficulties, but it's so worth it, because Dr. Agarwal and I have, fully take the blame. For some reason, we've been having so many technical difficulties with getting on Facebook, getting on YouTube. But now I know it's worth it, because I was just determined. I was like, I'm not going to let this go. And now I know it's worth it, because this is just a mere beginning, because we're going to have you back, Dr. Agarwal. We're going to have you on Facebook, because I know all my people on Facebook are dying to hear you. And I feel so bad. I'm going to hop on right now and tell them that we'll maybe come back next week. Okay. We're going to have you back on YouTube. If you love this live stream, if you love Dr. Agarwal as much as I do, please just leave it in the comments, because there's a lot more that we can go a lot more deeper into all these topics. And I want you to, all of you, go right now and get a copy of her book, Finding Balance. I'm certainly going to get a copy of that book. It's so surprising. You've surprised me so much tonight. And I'm sorry, I'm sounding a little congested, because it's the fires here in California, and the air is so bad. And I just wanted to finally say, if anybody has been affected or evacuated or displaced or lost their life, their homes and everything by this fire, all of us, our collective prayers go out to you. And just look at all the different ways that you can donate. There's lots of different ways that you can donate, and they do need donations. But with that said, I love you, Dr. Agarwal. As I said, it's literally the beginning, because I feel so bad that we've been technically sort of off, but I just know all my regulars are just kind of going to fall in love with you. So we'll have you back. And it's late with you. It's like 9 o'clock Eastern time, and you're a busy mom and a cardiologist. So I want you to go so that you can take care of you and your beautiful family. So thank you so much from the bottom of my heart for just kind of staying with all of this technical nonsense, and we'll get it down, you and me.
Yeah, these things don't trouble me. As long as your people were okay and happy and were able to hear things. These are minor things in the grand scheme of things. So
they truly are. Yeah. And they heard a message. Everyone who stayed on heard a message that was a really good message. You said 4 or 5 things tonight that will remain with me forever, and I hope it will for everybody else. So stick with it. And I think, the last thing that Dr. Agarwal said was just imagine your future. So that's the most powerful thing that anybody could say to you when you're reaching for that thing. And it's so interesting that you go, I can't give up. And it's always people always use the word can't give up my cheese, my wine, my chocolate, whatever it is. Imagine your future. I've never heard it said like that before. And that's so powerful. So thank you for that.
Oh, my pleasure. Yeah. I mean, I think one of the things I would just say to end it is, as I always tell people, you have one life. You got one shot at this. And as far as we know, we have one shot, and you want to make it fabulous, and you need to embrace every part of it. And I certainly plan to, and I continue to. So good luck to everybody, and good talking to you. And thanks so much.
Really good talking to you. Have a good night's sleep tonight. Bye-bye.
Bye.